Hey, everybody, guess what? We're back on this rainy Monday to talk about skin. We have Harpeth Valley Dermatology office with us. It's so great to have you guys back again. We've been talking about some subjects. Last month, we talked about um, dry skin. So we've all been prepping, trying to keep ourselves moisturized. But now we want to talk about something that I'm hearing so much about and so many people are struggling with is hair loss. And it seems to have happened a lot, you were saying, in the last couple of years. So talk us through why all of a sudden all of us have thinning hair or we're struggling with hair right now.
Absolutely, and thanks for having us back. Obviously, the last couple years have been drastically different than the time before, and so the thing we've been seeing a lot of, and I see much more frequently in clinic now, is it's something called telogen effluvium. And so telogen effluvium is a non-scarring type of hair loss, so meaning that the hair will come back eventually, but it's something you see frequently with a number of things. Stress definitely plays a big role in that. And then also big, physical events to the body. So things like childbirth or something that traditionally spurs that on, or having a big surgery, things like that, hospital stays. You typically see it about, 3 to 4 months after the inciting incident. So sometimes people don't connect those dots together because they're like, why am I losing my hair now? I've been fine recently. But it's really yeah, it's really what happened 3 or 4 months ago, that the hair is slow. And so basically, more or less what happens is most of the hairs on top of our head are in a growing phase. They call that anagen phase. And that's about 85% of hairs. And then another 10% are in something called telogen phase, which is more resting. And then the remaining 5% is catagen phase, which is kind of the intermediate zone there. But even a small shift in, growing to resting phase, just 1 or 2%, when you've got 150,000 hairs in your head, makes a big difference on, number one, what you can see on your scalp and how much your scalp you can see. And number two, the amount of hair that you're getting out every single day. And so that'd be the most common complaint that I hear from patients is, hey, I noticed a lot more hair in my hairbrush, in the sink, in the shower. And so just in relation to COVID, we've seen a lot of it post-COVID. Even people with subtle cases of COVID, I see a lot of hair loss 3 or 4 months down the line. And so people had more severe cases or anything that required hospitalization or anything similar to that, definitely. It's definitely a possibility to see that. There's good news and bad news about telogen effluvium. The hair will grow back. The bad news is it takes time. To fully return to normal, you're often talking 6 to 12 months, just
Oh,
because,
wow.
yeah, the hair is slow. And so everything with hair takes, when we're prescribing treatments for different types of hair loss, I always tell patients you will not see results till 3 or 4 months. It just takes a while. And so it's a double-edged sword. In the past, traditionally, we didn't, give out many medications for telogen effluvium because it's just like, hey, it's going to come back. Just give it time. But we've been a little bit more aggressive because we're seeing so many more cases of it now. And so with that, there's different topical and oral medications. One of them is Rogaine or minoxidil that you can get over the counter. They also have that in an oral form that is a prescription that we use quite often. Just can speed up how quickly things come back because it's obviously pretty distressing to go through any sort of hair loss. And being told that something's going to take up to a year to come back normally is a pretty long timeline often. So the one thing I usually encourage patients to just look at is just, what their expectations are and just modify those because everything will take time. And I usually tell people to avoid biotin and a lot of the hair vitamins just because oftentimes the data for that stuff isn't great and they're quite expensive. And so there's different things you could be using your money for because I don't want you to waste a bunch of money on a bunch of vitamins that aren't going to help a lot, but the bottle claims it will. So save your money. If you need something over the counter, Rogaine's great, but definitely come and see a dermatologist because there are a lot of different types of hair loss. And so we're pretty good at classifying it pretty quickly for you. And if need be, we sometimes take biopsies if it's something that's a little out of the ordinary.
Yes. Tell me about, I've also heard about some PRP treatments for hair loss. Do you guys do that as well?
We do, yeah. We more use that for, we can use it with any type of hair loss. I have male pattern hair loss, and so that's something, male and female pattern hair loss, we use quite a bit of PRP for. Results are actually great. basically no side effects except the day after. You might have a little bit of a headache because we're doing a bunch of injections just in the areas that you're noticing thinning. And so just adding that volume to the scalp, sometimes you get a little bit of a headache the next day. But honestly, the results have been really good, and you're not putting anything, foreign or any medication in your bloodstream. It's just us taking out your blood, spinning it down, and then taking off that platelet-rich plasma and just injecting it into the areas on the scalp. And so we usually tell people you need to do about a series of 3 or 4 of those spaced about 4 to 6 weeks apart. And again, it's going to take a while to see results. It's going to be a couple months, but I was a little skeptical at first when it became kind of in vogue about 5 or 6 years ago. And the results we've seen in our clinic have honestly been excellent. And so we've had a lot of happy patients with that.
Okay. So that could be a possibility. If they come and see you, you could say that could be a possibility if you don't want to wait the 6 or 12 months to get your hair fully back.
Absolutely. Yeah. PRP is the one nice thing about PRP. It can target almost any type of hair loss. There's some more severe scarring types of hair loss that it's not as good for, but a lot of hair loss, it really does improve it quite a bit.
Okay, well, we've learned a lot. I did not know some of these things you were telling me. So come see you guys. Go check it out. I guess if they wanted to try something at home, you're saying they could maybe possibly try over the counter first to see if that helps?
Yeah, never a bad starting place is over-the-counter Rogaine or minoxidil. That's something we use for pretty much all types of hair loss, so across the board. It's very safe, it's very affordable, and so that's always a good building block. That's one of the first recommendations I usually make. Obviously, it's not impressive as some of the things we can do prescription or injection-wise in the office, but got to start somewhere.
Right. Hey, before we go, I want to talk about this real quick. Next week is spring break. So many of us are going to Florida. We're going to hit the sun next week. Let's talk real quick about sunscreen protection. We've been in the winter cold. It's cloudy today. So our skin may be in a little shock when we get down to the sunny areas.
Absolutely. Yeah. And so, the couple big things I usually tell people is make sure you're, reapplying. That's the biggest thing that people forget is, you put it on in the morning and then you don't do it throughout the day. Really, every 2 hours is what you want to do. Wearing a hat obviously helps a ton as well. But as far as the sunscreen itself, you want to make sure you're using something, at least 35 SPF or better. I usually recommend 50 plus. And then for the best protection, you want to make sure it's something that has zinc or titanium or both. Those mineral sunblocks are more effective. They last longer on their skin and they just work better. And so really want to ditch the chemicals. You want to ditch the sprays. There was a big thing about the spray sunblocks late last summer / early fall. And so I routinely don't recommend those anymore, but getting something SPF 50 or above and just remembering to reapply every 2 hours or so. That's the biggest thing. I think the reapplication gets lost sometimes.
I would have to agree with that because you get busy and then you forget and you're like, oh man, that was 4 or 5 hours ago. I put
Exactly.
on sunscreen.
Yep.
Do you have any?
Remember, it's the biggest thing.
Yeah. Do you have any recommendations for any that we can buy over the counter at your local drugstore that we can take with us for on our trips?
Absolutely. My favorites for over the counter that are particularly mineral based, Neutrogena makes some good ones. One called Sheer Zinc. You just really have to rub it in. It's pretty thick stuff, so you just have to rub it in. And then La Roche-Posay makes a variety of pure mineral ones that also include tinted variants that are good for people with a little bit more pigment in their skin, just because they blend in a little bit better. But those are my top 2 over the counters. They work great.
La Roche-Posay. They have great. I like some of their other products as well. I've tried some of those. So that's great recommendations. Thank you so much. We got it right here from your local dermatologist. Couldn't get any better than that. Hey, thanks for joining us today. If you guys have any questions, I heard you're still taking patients, so you can come and see you in person if you have any concerns about anything we've talked about today. Tell everybody how they can do that.
Absolutely. So I'm Dr. Bashline. I'm one of the 3 board-certified dermatologists over here at Harpeth Valley Dermatology. We've got locations in Smyrna and then in Thompson Station. And so we've got our website, www.harpethvalleydermatology.com. You can go on there and book an appointment or just give us a call at 615-905-8083, and we'd be happy to get you in and get you taken care of.
Okay, thanks again. Hey, you guys, enjoy your week, and we will be back soon. Bye, everybody.
Thank you.
Thanks. Okay, we're waiting for this to end. I see the clock is still counting. Hang on, we will